Pediatrics IV Fluid Preparation and Calculation. Welcome to this essential training module on pediatric IV fluid preparation and calculation. In this video, we will simplify the science behind calculating, preparing, and administering IV fluids for young patients, a critical skill every nurse must master to ensure safe and effective care. What are IV fluids? Intravenous fluids, or IV fluids, are sterile liquids administered directly into a vein. They restore water, sugar, and electrolytes, especially when a child is ill, undergoing surgery, or unable to eat or drink adequately. Understanding what they are is the first step in administering them correctly. Why is IV fluid calculation necessary in pediatrics? In pediatrics, one size does not fit all. IV fluid must be calculated precisely based on body weight, clinical condition, and fluid losses. Under or overinfusion can lead to serious complications, including electrolyte imbalance or cerebral edema. That's why calculations must be individualized, monitored closely, and never titrated randomly. IV fluid preparation, maintenance, deficit, and resuscitation. Let's break down fluid requirements. Maintenance fluids meet a child's normal daily needs. Deficit fluids replace what's lost due to dehydration. And during hypovolemic shock, resuscitation with isotonic fluids like normal saline is critical. Avoid hypotonic solutions, especially in emergencies, to prevent worsening cerebral edema. IV fluid requirement according to the child's body weight. The daily fluid requirement varies according to body weight and is calculated as follows. Body weight: 1 to 10 kilograms. Fluid requirement is 100 milliliters per kilogram per 24 hours. Body weight: 11 to 20 kilograms. Fluid requirement is 50 milliliters per kilogram per 24 hours. Body weight above 21 kilograms. Fluid requirement is 20 milliliters per kilogram per 24 hours. Maintenance example. Now, let's apply the formula. If a child weighs 9 kilograms, we multiply 100 milliliters per kilogram, totaling 900 milliliters in 24 hours, or 37.5 milliliters per hour. A 15-kilogram child needs 1,250 milliliters in 24 hours, which equals approximately 52 milliliters per hour. These step-by-step calculations ensure safe infusion rates. Deficit. Fluid calculation. To calculate deficit fluid, we estimate dehydration percentage based on clinical signs like heart rate, blood pressure, skin turgor, urine output, mucous membrane, tears, and skin perfusion. Dehydration levels: 5% mild dehydration, thirst and slight fatigue. 10% moderate dehydration, dizziness, weakness, and low urine output. 15% severe dehydration, life-threatening, confusion and loss of consciousness. Immediate medical help needed. The total deficit is given in 2 phases, half in the first 8 hours and the remainder over the next 16 hours. Time delivery is key to effective rehydration. Deficit fluid example. Let's look at an example. A 10-kilogram child with 10% dehydration needs 1,000 milliliters to correct the deficit. Add that to their maintenance of 1,000 milliliters, and the total becomes 2,000 milliliters over 24 hours. The first half, or 1,000 milliliters, is given over 8 hours. That's 125 milliliters per hour. The second half is delivered over 16 hours, or 62.5 milliliters per hour. Accuracy matters. Drug calculation: why it's critical in pediatrics. Next, let's understand drug calculation. Children aren't small adults. Doses must be adjusted for age and weight. A miscalculated drug dose can have life-threatening consequences. Dosage conversion table. Dosage calculation conversions. Here are some basic conversions to remember. 1 kilogram equals 1,000 grams. 1 gram equals 1,000 milligrams. And 1 milliliter is the same as 1 cubic centimeter, and so on, as shown in the table. These are essential for all dosage calculations and IV preparation. Young's rule, age-based calculation. Now, let's look at Young's rule, which is used for children 1 to 12 years of age. The formula is child's dose equals the child's age in years divided by age plus 12 multiplied by the adult dose. This helps us adjust an adult dose safely for a child based on age. Let's calculate dosage based on age using Young's rule. For a 10-year-old child prescribed an adult dose of 500 milligrams, we use the formula age over age plus 12 multiplied by the adult dose. That gives us a safe child's dose of approximately 227 milligrams. Dilling's rule, another age-based approach. Dilling's rule. Now this formula calculates a child's dose using age. Child's dose equals the child's age in years divided by 20, multiplied by the adult dose. Dilling's rule is another age-based formula. For example, a 5-year-old child prescribed 400 milligrams of ibuprofen would receive 100 milligrams after applying the formula. These age-specific methods guide safe prescribing. Fried's rule, for infants under 1 year. Fried's rule, up to 1 year of age. Next is Fried's rule, which is used for infants up to 1 year of age. The formula is child's dose equals age in months divided by 150 multiplied by the adult dose. It calculates dosage based on age in months. For a 10-month-old baby prescribed an adult dose of 50 milligrams, the infant's dose is 3.3 milligrams, a tiny but critical adjustment. Weight-based calculations, Clark's rule. Now, let's look at Clark's rule, which calculates a child's dose using body weight. If the weight is in pounds, the formula is child's dose equals body weight in pounds divided by 150 multiplied by the adult dose. If the weight is in kilograms, use child's dose equals body weight in kilograms divided by 70 multiplied by the adult dose. If an adult dose of medication calls for 30 milligrams and the child weighs 30 pounds, we can calculate the child's dose using the formula. Child's dose equals body weight in pounds divided by 150 multiplied by the adult dose. That's 30 divided by 150 times 30 milligrams, which equals 600 divided by 150, so the child's dose is 0.4 milligrams. You've learned the core principles of pediatric IV fluid preparation and calculation, where precision ensures safety. Keep practicing with care, accuracy, and compassion to deliver the best outcomes for every child. For more practical clinical videos and learning content, visit www.healthcare-eskilling.com. Thank you.